And welcome, my name is Adam Wylęgała and today I am going to review Corvis tonometer that's connected to Pentacam AXL Wave. Both machines are manufactured by Oculus and this is something more than just a tonometer. It's probably the most accurate tonometer, but on top of that it provides you a lot of information about the biomechanics of the cornea. So please stay with me and watch the review of Corvis from Oculus. This is the Corvis ST. It looks like a king cobra from the outside. It has the chin rest and the headrest. Chin rest is operated up and down using the buttons on the display, so you don't need to use any screws. As you can see, it stands next to our Pentacam and we have one computer, so both machines are connected to the same computer. Our model is pretty old. You do not have touchscreen here. I'm not sure about the newer models, but this is how you operate. You just use this screw and you also have the buttons on the left. If you want to select something, you just click on that value. These are, by the way, the settings that you can change. As you can see, this probe is a little bit pointy.
Pointy is scary.
It is scary because you can poke somebody's eye. So in order not to do it, then there is the blockade. So this is normal position of the machine. And if the patient has very deep orbits, you need to click on this button and then you can move it further. So safety is also a priority here. This is how you operate the machine. You just hit the database with Pentacam and then you click Corvis. You just need to manually put close to the cross and then the machine itself takes the image. There's also a semi-automatic mode when you hit the button and you will see the Scheimpflug image. The cornea needs to be below this white bar, so the apex, and then you can click again and you will have the manual measurement. This is when you did both eyes, this is what you will see. So you'll see the Scheimpflug movie, you will see the information on the IOP and the pachymetry. You can save it, and this is these are for both eyes. It takes some time to save and transfer the data to our computer. What is Corvis? Corvis is a combination of an airpath tonometer and an ultra-high-speed Scheimpflug camera. How fast is this camera? Well, this movie was created in 24 frames per second. The movie that you see cornea changing its shape under airpath is created in 4,300 frames per second. That's the speed of the camera. So within 31 milliseconds, the camera records 140 images, and this gives you this amazing speed. Corvis will give us three information. Firstly, about the IOP, right? It can work as an IOP measurement. Secondly, about the biomechanical response parameters of the cornea. And then thirdly, the corneal thickness. This is the first screen of Corvis. Here you have the information about the tonometry, pachymetry, IOP progression, Scheimpflug movie, Scheimpflug image, and also corneal thickness along the horizontal section plane. And the gray lines, they represent 95% of healthy population within this thickness. We are going to start with dynamic corneal response parameters. First parameter is deformation amplitude, deflection amplitude, and whole eye movement. So you have three lines on that graph, and the deformation amplitude describes the movement of the apex in vertical direction. This movement depends mostly on IOP that opposes the airpath and on the overall corneal stiffness that also resists the deformation. So basically, the greater the IOP, the higher the corneal stiffness, the smaller the deformation amplitude is going to be. That's pretty simple. The whole eye movement describes the movement of the whole eye, also in vertical direction. This type of movement depends on the biomechanical properties of the sclera and fat tissue behind the eye. The deflection amplitude describes the movement of the cornea and therefore has a stronger dependency on corneal properties. It is calculated as the difference between the deformation amplitude and the whole eye movement. Next parameter is the applanation length. So this is the length of a line that describes the applanated cornea. And here stiffer corneas have larger applanation length than softer corneas. Another parameter is, again, self-explanatory. This time it's the corneal velocity. That's the speed of the corneal apex as it moves inward. So that's the positive velocity. And then you have the outward movement, right? When it moves, let's say, outside from the retina. That's the negative velocity. Next, we have delta arc length. This describes the change of arc length during the deformation response in a zone that's 3.5 both sides from nasally and temporally, so it's totally 7 millimeters. As the cornea is under tension before the air pulse is applied and the anterior tension is decreased through the deformation, the arc length decreases until the time of highest concavity. And after laser vision correction, this amount of shortening is reduced compared to non-treated corneas. Next, we have DA ratio. This parameter is calculated based on the ratio of deformation amplitude at the corneal apex to the deformation amplitude 2 millimeters nasally and temporally from the apex. So it's basically like the difference between the deformation apex and deformation in the periphery. In cases of softer tissues, the cornea will start to deform in the center and less paracentrally, right? So DA ratio is higher in softer corneas than in stiffer corneas, which they show greater resistance to deformation, let's say uniformly within whole cornea. The last parameter is the integrated inverse radius. A softer cornea will exhibit a smaller radius, greater curvature than a stiffer cornea that has lower curvature. This software calculates the inverse radius, which is equivalent to concave curvature and determines the area under the curve of inverse radius versus time. A decrease in this parameter indicates greater resistance to deformation, which is naturally a characterization of a stiff cornea. Now we are going to talk about Vincuguerra Screening Report. It consists of 3 parts. The first part, these are the diagrams of the corneal biomechanical response over time, along with the normative data for comparison. The second part shows you the values of the 4 most important parameters compared with the normative values. And then the third part shows you the Corvis Biomechanical Index. So this is the CBI in terms of color scale. Why do we need that type of report? Well, we were talking that the IOP is influenced by the biomechanics of the cornea, right? This is important for glaucoma, but it also works the other way. That means the IOP influences the biomechanical of the cornea. I mean, not exactly, but if you want to measure biomechanics of the cornea, you need to account for the IOP. So all these graphs, they look the same in that regard that you have the left graph. This shows you the time of the curve and then selected parameter. It can be deflection, amplitude versus time. And then on the right side, you have the results against the normal range versus the BIOP, so biomechanical adjusted IOP. And then you have the SD range of the normative values. They are shown within the gray lines. Below you will find the standard deviations from the mean for each of the 4 screening parameters: DA ratio, integrated radius, ARTH, and SPA1. And then you will find the CBI. CBI is calculated using logistic regression formula from 6 different parameters. Values below 0.25, there's a low risk of ectasia. Moderate risk of ectasia is between 0.25 to 0.5, whereas everything above 0.5, high risk of ectasia. It's based on the biomechanics, it's not based on the elevation or any other topographic parameters. There's also one more parameter that we haven't talked about. This is the stress-strain index. So the corneal stiffness depends on 2 issues. We can call them geometric stiffness, geometric parameters. This is basically the corneal thickness, corneal radius, and corneal curvature. These are all geometric properties of the cornea. They are going to influence stiffness. Secondly, the properties of the material from which cornea is built are going to influence stiffness. Corneal scarring, corneal deposits are going to influence, obviously, as much as thickness. That's why all these IOP thickness compensation tables are not worth using. Here we have the stress strain index on the curve that depends on the pressure, and shows you deformation under pressure. So obviously, if you add a very high level of pressure, deformation is going to happen no matter what. But deformation is going to be much larger with lower pressure in softer corneas. So this SSI index is going to be less than 1 in very soft corneas, while in very stiff corneas it's going to be more than 1. And that means you have smaller deformation than in softer corneas. The question that you can ask is, can this technique replace topography? Well, my answer is negative. Topography still is the gold standard for detection of keratoconus, but it can aid you in the cases where it's not really clear that the patient has keratoconus. In that way, you can prevent iatrogenic ectasia after refractive surgery. This is something that probably all the refractive surgeons are most afraid of. And for this, you need biomechanical topographic assessment view, where you have best of two worlds. So on the one hand, you have the Corvis biomechanical assessment, 4 parameters clearly displayed with the statistics of the normal population versus the keratoconus population, and you see where your patient is located. And then you have the pentacam, axial map, anterior, then you have the pachymetry map and corneal thickness spatial profile. Below also you have the BAD values of that patient. So in that particular patient you see pentacam is showing no keratoconus. Okay, what about Corvis? Well, Corvis is showing you CBI. I've already talked about CBI. It's 0.046, so it's just below the threshold. And then we have the TBI. TBI stands for Tomographic Biomechanical Index. And again, it's pretty self-explanatory. It combines BAD and CBI together, but it's not a mean. It's made by artificial intelligence with machine learning so that you get another parameter. And in that patient, you see CBI, TBI is different. The question that the patient had was, is he a candidate for refractive surgery? My opinion is he's not, because the TBI is red. TBI shows that he has a very high risk of ectasia after LASIK. As we are using one computer for Corvis and Pentacam AXL, you just need to click this tiny little Pentacam head to see your beloved Pentacam screens, and then you can see all the different parameters. And if you just close this, then you're back with Corvis once again. If you want to see progression, you better click on the BEST, that stands for Biomechanical E-Staging Homburg. So this is the equivalent of the progression display on Pentacam. Here you can see different examinations. You can select multiple, you can select 2. When it comes to the Scheimpflug video, you can only see 2. And you see that those 2 corneas are superimposed on each other. Then you have the 4 parameters that we already talked about. And on the graphs, you have the scale with the SD values for the normal population. And on the scale, you have this information: soft, hard, thick, and thin when it comes to RTH. This is the most useful for looking at corneas that underwent cross-linking. Like in this case, you can clearly see that the green cornea is not as soft as the red cornea, right? It's not moving as far. And then you see that the DA ratio, the radius, and all the parameters are actually lower after cross-linking, except for the RTH. That's more or less correlates with the thickness of cornea, because naturally a month after cross-linking we can expect some thinning, but not as much to influence this parameter. The stress-strain curve also shifted to the left, indicating that there is much higher stiffness after cross-linking. But this is not everything. It's not just the progression that we want to see here, but there is also another type of staging, the E-staging, staging based on the elasticity. So that's why it's called E-staging. This E-staging can be seen as an adjunctive tool to the ABCD staging that's embedded within the pentacam. And it's also another way to see progression. It's not just the elevation, it's not just the ABCD parameters that change, but we can assume that firstly you will see the progression in biomechanics, in elasticity, and this is where you can see this type of progression within Corvis. By measuring biomechanics, Corvis is also able to distinguish between normal population and population who is prone to normal tension glaucoma. There is this biomechanical glaucoma factor, again with a color graph, red is bad, and there's also a value for people who are going to probably use it for research. You have basic information like tonometry, pachymetry. You can also adjust this tonometry to biomechanics or Dresden table as you wish. And then below you have the IOP progression. That's extremely useful for patients who have who you monitor, so you can use this as a monitor. In that case, you see the cornea is somehow different. This is a patient who underwent corneal transplantation, and because of that, he doesn't have like typical biomechanics of a healthy cornea, but the patient had secondary glaucoma. He needs to have anti-glaucoma surgery, and as you see, it worked pretty well. Okay, so now it's the time to review Corvis ST. What are the biggest advantages of this machine? Well, one of the most clinical significant advantage of Corvis ST is its ability to provide biomechanical corrected IOP measurement. All the traditional tonometers are significantly influenced by corneal properties such as thickness, age, and biomechanical characteristics. And this machine addresses these limitations by incorporating corneal thickness, patient age, biomechanical response data to calculate more accurate IOP that is less dependent on these confounding factors. Secondly, this machine excels in early detection and screening of corneal ectasias. This Tomographic Biomechanical Index, TBI, created by combining Corvis ST biomechanical data with pentacam topographic information, it really optimizes ectasia detection by improving both sensitivity and specificity for identifying patients at risk. Thirdly, Corvis provides capabilities for monitoring treatment effects, particularly after cross-linking, because unlike topographic changes that takes months to manifest, this device detects biomechanical changes such as stiffness very early after cross-linking procedure. That means you can see the effects of cross-linking much faster than using a standard topography, especially if you have a haze in cornea. Then seeing the changes in posterior surface using Scheimpflug is quite a challenge. What are the limitations of this machine? Well, firstly, this machine and its software, the abundance of data, while comprehensive, can be overwhelming for clinicians unfamiliar with corneal biomechanic principles. It took me a month to read the manuals, understand what this machine is all about, and still I'm not using all of these parameters. Secondly, it's expensive. If you're just looking for a simple tonometer, this is going to be the most expensive tonometer on the market. I'm not sure if you are going to benefit from it. Thirdly, the patient, what they say is that this is the hardest air path that they've ever tested. So it's pretty rough on the corneas. And that's another issue in cases of people who have risk of perforations. Don't use AirPuffs. Further, it takes some time. You need to put the patient's name into database, then you need to do the measurement. Also, this is a Scheimpflug based technology, so it's prone to natural light, and you need to have a dark room to use this. I mean, it stays next to our pentacam, so in a dark room. For us, this is not a problem, but you need to consider that. Another issue is that I'm not sure if you've noticed, but there was a possibility to use two references when it comes to ethnicity groups, East Asia or general population. I can imagine that some extreme myopia cases, pediatric population and other certain ethnic groups, this parameter might not be really reliable. What are the competitors? And there is the one company called Reichert, and they produce Aura, which stands for Ocular Response Analyzer. And Aura gives you two parameters. Firstly, it gives you the corneal hysteresis and then corneal resistance factor parameters. We have Aura. We use it very often. What are the two downsides of Aura, in my opinion? Well, firstly, Aura doesn't have a chin rest, which in theory should make it much faster. But actually, because it doesn't have a chin rest, most patients would just put their head in the way that, it's not going to be measurable, and then use a lot of time trying to fit their forehead into the forehead rest and then measure. Secondly, Aura does not display the image from the camera, so you are not sure where the applanation is happening, and Aura is not as complex, so it doesn't have all these detailed graphs of the biomechanical information, and you cannot connect it to Pentacam. Who is this machine for? Well, I would say, firstly, it's the second opinion cornea centers like ours. I have many patients who are coming for a second opinion, whether they should get refractive, whether they should get cross-linking, whether they do have keratoconus or not, and this combination of topography and biomechanics, two machines on one computer, it really allows me to give them the final answer. Yes, you have keratoconus. Yes, you can have refractive surgery, or no. Secondly, naturally, refractive surgeons, I think, you should buy this for safety of your patients and, after all, yours as well. And thirdly, glaucoma specialists, right? After all, we have plenty of patients with weird corneas, patient after transplants who happened to have sutures, who happen to have band keratopathies, and then you don't really know what you're measuring if you're measuring it on general machine. Here, I feel safe when I see the measurement. I feel that it's really the closest to the IOP inside the eye. Not many people know that the Corvis also has this screening parameter for normal tension glaucoma. And normal tension glaucoma is definitely a challenge for glaucoma specialists, and I feel that many people don't know about this machine, that this machine is not just for keratoconus, but also gives you the ability to diagnose and screen patients for NTG. To summarize, Corvis ST is a non-contact tonometer that uses a high-speed Scheimpflug camera to record cornea's reaction to an air pulse. By analyzing corneal deformation, it provides detailed biomechanical parameters and calculates a biomechanically corrected IOP, which is less influenced by corneal properties, improving the accuracy of glaucoma diagnosis and also ectasia screening, making it a valuable tool for corneal assessment. Thank you very much for watching my review. I hope you've enjoyed. Please subscribe to my channel, and goodbye.